Good afternoon, everyone. Am I audible? Hello?
Hi,
Please.
Siddharth. You're
Okay,
audible.
thanks.
Rajesh bro, everything is okay, na?
Good afternoon, everyone. A very warm welcome to another monthly webinar session by Dr. Basil's Homeopathic Hospital. Let's start with a silent prayer. First of all, I would like to wholeheartedly invite Dr. Basil Yousuf, who has provided us this session, which is also need of the hour. Welcome, Doctor.
Thank you.
Secondly, I would like to invite Mr. Tajesh Vaish, who's the speaker for today's session, and he's going to enlighten us how to explore artificial intelligence in our daily diagnosis and prescription. Welcome, sir.
Hi, everyone.
Before starting this session, I would like to invite Dr. Basil Yousuf to speak a few words.
Thank you, dear. Thank you. First of all, thank you for the opportunity. And I'm not at all taking the time of our chief guest. Let me introduce him. First of all, introducing him is a big task. So I request him to introduce himself before starting because an IIT engineer, as we know, we have done the entrance examination. So we know how tough the IIT is. So it is very lucky to have an IIT engineer who is have association with homeopathy and he is developed a system for homeopathy. So definitely we admire you. That is what the intention and motive of today. I have brought him to the homeopathy community. In this meeting, there is not only our hospitals doctors, but also doctors from all over India is there. Now 55 participants right now itself is there. First of all, there is a changing era. If we are not taking artificial intelligence into our practice, we will be out. Just like Ambassador car and Nokia mobile phone as well as Kodak film company. We have to update as per the generation. Now it is the generation of artificial intelligence. We are taking our ultimate study and we are having a wing to learn all these things and teach all these things and implement all these things. As a part, I have searched several alliances. One of them is Homeo AI Tajesh Wise. They are developed a very great Homeo AI. So they will introduce it. They will teach right now how to handle artificial intelligence in our practice. Simply speaking, I am requesting Tajesh Bhai to teach our doctors if one patient is coming, he is having chest pain. If so, computer will ask where the side, right or left. So we will tell it is right side. So it will give an answer. So no need to heavy worry, but still have to go. Tell me what is the food you have taken. So it will tell potato I have taken. So it will tell. So more chance for gas. Then another question. Then it will be reaching into a final diagnosis as well as a diet chart, as well as a precautions chart, as well as a provisional diagnosis, everything. Same way if it is left side. So it will be towing. This is dangerous. This is like this, like this. Such a thing he have shown me the demonstration. So I frankly speaking, this our homeopathy community should see. That is what I have taken you. So I request Tajesh Bhai to demonstrate and I request doctors to learn and utilize it. My session I am completing by telling only by one word because our master Dr. Christian Frederick Samuel Hahnemann taught us to do what others are not doing and to do in advance. Our master is the person who invented actogens before others are telling. Our master is the person who invented iatrogenic disease as well as bacterial, as well as psychosomatic diseases, everything before years, even others are thinking about it. So as a follower of our master and true follower of homeopathy, we should be the advanced one. So I request all of you to utilize this. I am handing over mic to Tajesh Bhai. I once again wholeheartedly on behalf of me and hospital requesting Tajesh Bhai to the program. All of you, all of us can welcome our Tajesh Bhai to this program. I once again requesting Tajesh Bhai to introduce yourself so that only our team can understand you more clearly, because if we are introducing you, that will be somewhat official only. So please do this. Please introduce yourself as well. Once again, thank you.
Hi, Doctor. Hi, Siddha. Hi, everyone. Thanks a lot for a warm welcome. So, hi, everyone. So, basically, my name is Tejesh. I'm an IIT Kanpur pass out. So, basically, just giving a brief background how what AI is doing right now. So, like, um, like in recent year, the AI have advanced to such a point that like it can process very large amount of data. It can reason through things. It has literally become a human brain. That's why we call it artificial intelligence, because it is like an intelligence, but it is artificial. And it is helping a lot of, like, lawyers are using it, like students who are going to the school are using it, teachers are using it, normal people who are doing their PhD are using it. Like, it is being used in almost all fields right now. And like homeopathy is also like one such a use case we identified, that like AI could help a lot here, because the literature is so vast. There are so many remedies, there are so many diseases, there are so many symptoms, and it is very hard for a single doctor to be like aware of everything at the time when they are talking to patient. At that interaction, like it is very hard to like reference to everything. So the AI comes and gives you that superpower. Like you can ask it, like you can give it your symptoms, you can give it your for example ECG report, you can give it the like photo of the skin if there is some skin disease, to ask about what do you think like this disease is. You can tell him your main chief complaint, as the Dr. Basil was saying, like you have a pain in the chest, like, or the what side of the chest is it. Then based upon that, the AI can ask you follow-up question, like just like how a doctor asks, like and it can give after like it asks you for some particular question, it will give you a bunch of like professional diagnosis, and, and the confidence score for those diseases, like and it also tells you like what diagnostic steps you can take. So as we know, like homeopathy is a very advanced science. Like it does not involve this is the medicine and symptom. It also involves the modalities. It also involves the miasm. So all it's very layered. There are multiple levels of layer which are involved in finding out the correct constitutional medicine diagnosis for the patient. So we have basically invested like a lot of money, a lot of talent, a lot of time in developing this software, where my team is of around 10 IIT engineers, all from IIT Kanpur pass out. So we have talked to hundreds of homeopathic doctors, like literally from all over the India, even Pakistan and UK, US, like all over the world, doctors are using a platform. And we have personally talked to them, asked them like what do they want, what is their use case, what are the problem they are facing, and what is the main pain point. Then they have told us that the main thing is there are a lot of the data is there, but it is not very clear. Like everything is very scattered. Like some people refer to repertories, some people like you can only know like certain things at a point, but if you have access to artificial intelligence, you can literally leverage it's like having a very advanced doctor always by your side. You can always ask that doctor a lot of questions. You can talk to that doctor and tell him that you are thinking about this, what do you think that it should be the out, is it right or wrong. So we have basically trained multiple AI agents So which things which can help you in your practice to become, so that you can become a 10x doctor, homeopathic doctor. You can you can do a very perfect diagnosis of the patient disease, and you can give them the best possible remedy, because the diagnosis is the most hard part in identifying while talking to the patient. So now I will share my screen and show you guys what all how what we have developed, and how yeah. Is my screen visible?
Yes, sir.
Yes,
Yes.
Tejas. Okay. Yeah, this is our main site. So basically, as you can see, precision homeopathy powered by autonomous clinical intelligence. So basically, to diagnose a disease, there are a lot of literature out there. Lot of authors have written about differential diagnosis around the steps you should follow to get the disease, 5-minute diagnosis, and lot of literature which doctors study in becoming an expert at diagnosing a disease. So basically, we have made this platform which makes it very easier for doctor to basically if doctors can enter their symptoms, the doctor can enter their modalities, and then we suggest them the best diagnostic remedies. And the most important part is because this is AI, it learns from your every case. So if you talk to it once, the next time you will talk to it, it will remember what you said in the last thing, and it is like a human, like it learns from every experience. uh, so this is a brief about us, and now I will quickly jump on to the main agent. So basically, I have sent the link in the chat. You can see. I request every one of you to just click on that link and go to the platform, the chat.homeoai.com. This link. If you click on that link, it will take you to the sign up page, where basically you can sign up and enter your details. I am already signed in, so it is directly logging in. Uh, yeah. So for example, here is one particular case. As you can see, there was a patient who had a heart disease, but so doctor recommended them to do their ECG. Then I gave the ECG image to the diagnostic agent and ask them, based upon this ECG, what do you think that the patient is suffering from? So it gave me an reasoning on that, it is a left bundle branch block, and it is giving the probability at about 60% probability is think that this is a particular disease. And it also tells you the reason for the same, that there is a QRS, dominant broad R in the IL V5 V6. So and it gives you a bunch of disease. So like someone who is not an expert, let's imagine a doctor who is not an expert in reading the ECG machine, ECG images. So with the help of the AI, the doctor could find out uh, what is the particular disease this patient may be suffering from, and based upon then we can decide the medicine. We also tell our agent also tells what you can do here, you can repeat this test to confirm this, or you can do this CBC CMP test, and it also tells you what all the reasons behind same, why do we think this is the disease, and what all the lifestyle changes you can take to support this along with all the medicines. So this is one particular use case. Another use case is yeah. So for example, this is there. So basically, for example, let's assume there is a patient who comes to you and they tell them that they are pregnant and they are having headaches. This is their primary complaint. So the agent will ask you, like, did the headache come on suddenly and severely, or is it developed gradually over time? So it asks you this particular question, and it also tells you the reasoning that why is it asking this question. So so if you tell the agent that it has developed gradually over time, then it asks you one more question. Like, have you noticed any of these symptoms: blood vision, flashing lights, swelling of your hand or feet, abdominal pain, or elevated blood pressure readings? Then you ask then you tell the agent that yes, I have observed the blood vision. So based upon these data, the question and answers you give it to agent, it tells you that there is a disease known as preeclampsia. Because you are pregnant and having headache and visual changes, there is a very high probability that you are suffering from this disease, and you should this. And it also does not rule out other disease. So it could also be a migraine, because this is a headache. This is also a tension type headache. It could also be a cerebral venous sinus thrombosis. So it gives you all the diseases, and it tells you like why do we think that this might be a diagnosis, or why do we think that this may not also be a diagnosis. So it gives you both the evidence for and against, and it also tells you that what are the recommended tests you could do to validate this further. You can do a blood pressure management to screen for preeclampsia. If BP is very high, then that is a concern. You can do a urine protein test to confirm whether this is a proteinuria. If the protein is very high, then support preeclampsia. You can tell the patient to do CBC, CMP platelet count, and we can see like if the platelets are low, it could tell that it could be liver enzymes in the severe preeclampsia. So basically, it gives you all the reasoning behind based upon the questions and answer it receives from you. For example, if I go to one more case, just see this. So there's a patient who comes up with a skin disease where there are rashes like this in the patient's body, and you are not sure, like this could represent a bunch of skin diseases. So but if you give this image along with tell the agent that this is the rash you have, the agent will give you the pretty good thing that this may be the candidal in vertigo, yeast infection in the skin fold, and it is with the highest probability this is the thing. It is also telling why is it the case, because there is a red moist rash in the skin fold, satellite lesions common in warm and moist areas. So you have a very good head start. Till now, there could be hundreds of skin diseases it could have been, but with this agent you are very pinpointing, give you a very exact result, like why do we think this is a disease. And it also has some tests. You can do a skin swab test, KOH prep, to identify the fungal elements. If we can do a fungal culture to specify if the species, if the infection is confirmed. We can do a blood glucose test to evaluate whether there is any diabetes risk. So this is all the use cases of this agent. So basically, there is one more thing. So a lot of patients might come to you with reports, right? With a lot of blood reports. So here I have basically uploaded uploaded the blood report of a patient. Then tell the agent like there is a pain in the chest. Then the agent read the blood report and amend my question, and it will ask me follow-up question. Does the pain does the chest pain pressure tight, or does it get worse with physical activity or stress? So I tell it yes, it gets worse with physical activity. Then it also asks me, do you feel short of breath, sweaty or nauseated when the chest pain occurs? Then I tell it yes. Then it tells me does the pain radiate to your left arm, neck, jaw, or back? So I tell it yes. So it again asks you one last question: does the pain improve when you rest or take any hard or antigen medicine? Then I take it yes. So because of my question answer, because it was pain which get worse on, because of which I feel shortness of breath, and it radiates to my left arm, neck, jaw. So there's a very high probability that is because of myocardial infarction or unstable angina. So it gives you a probability that with 80% probability we think that this is something related to heart myocardial infarction, and because there is a pain like extensional pain relating to arm, neck, jaw, associated with shortness of breath, improve with rest. So we should immediately take the medicines which are relevant for this disease. So yeah, this is just the one of the agent in our platform. So if you see on my left hand side, there's my cursor. Like we have lot of agents. We have this diagnostic agent. There is one Homeo AI Copilot. Like basically, in the Homeo AI Copilot, you can tell it that yeah. So like this coming to the other agent. So in the Homeo AI Copilot, you can give the agents all the symptoms that the patient is suffering. So for example, nosebleed that stops, shortness of breath, followed by chest relief after every episode. So basically, you give it all the symptoms, then it will give you a symptom summary card that what is the symptom, what is the character, what is the localization, effect and sequence, severity, moderate, significant, distinct. And based upon that, it will give you a clinical decision guide that nosebleed gives release to chest operation. Then it asks you one more question: is the bleeding short or profuse? If you say yes, then this is the medicine. If you say bleeding is recurrent or passive, then this is the remedy for that. If the bleeding with venous status or heart problem, then this is the remedy because of the reason. So it also gives you an internal representation table where it lists all the remedies and the category of those remedies, whether they're plant, mineral, animal. It tells you what are the keynote indications of those remedies, the modalities, the potency, the score. And it also tells you the exact rubrics from all the homeopathic literature that knows epistaxis, profuse, short lasting, just release after and the remedies. And it gives you detailed remedy cards that for this disease, like the cactus glandifolus can be used. And these are the keynotes for that. So yeah, like this is like a generic AI agent which gives you which takes you where you start with the symptoms, modalities, and it gives you the final remedies with all the explanation, like what is the disease we think for it. So you must be knowing like a lot of doctors use Murphy, some doctors use synthesis, some doctors use Boger, some doctors use Kent, some use Herring, some use synthesis. So we have AI agents for all of them. So if you ask, for example, in the FATAC, remedies for seasonal allergies, with sneezing, watery eyes, itchy nose. So like now our AI agent will only reference the information based in the FATAC repertory. It will tell you like this is the symptom summary card, and if the allergic and rhinitis, hay fever, then it will ask you question, paroxysm of sneezing, like this is the case, then you should consider this. If the discharge is burning or rawness, then arsenum album is good. If it is alternating obstruction, change of site, then natrum utricum is the medicine to go. If watery, bland discharge from eyes, but atric from nose, then Alicium cepa is the medicine. So it basically gives you a very good clinical decision guide, which you can use to pinpoint exactly which medicine you should use to basically guide the doctors, basically to give the patient. And it also gives you a detailed repatriation table with all the remedies, all its categories, its keynotes indication, its main modalities, the potencies, the score, everything you have. And just to give you even more confidence, it also gives you the rubrics, exact rubrics from the books. So that's on the FATAC. There's a nose, coriaza, profuse, watery, accurate, the para rubrics, the remedy considered, its weight. Then at the last, it also gives you what we think as a single remedy should be the best for this case. So in this case, according to FATAC, in this scenario, acute sinusitis, Allium cepa is the best medicine to be given. So yeah, this is the thing. This is, and some doctors do not refer to any repertories; they directly refer to materia medica. So this is the agent which has knowledge to around 10,000 remedies all over the homeopathy literature. So you can like talk to it about like what the same case, and it will give you like it can compare acnonite and belladonna for fever. Like when would you choose one over the other? So I am sure like a lot of you, some of you at least would have used ChatGPT in the past. So ChatGPT is a general purpose AI. It will if you ask it some question, it will give you very generic answers. It won't be able to like have the complete reference. It won't have like much detailed insight into the same. But what our agent is very specialized. It has it has been trained. It has been developed in such a way that it is a very senior doctor. Like you can consider ChatGPT as a very junior kind of doctor, but but our agent is very senior doctor who has a very particular uses. Like you can even ask our agent like like some medicines for lung cancer, breast cancer, etc. Like all those kind of very complicated thing you can do here. So for example, here I had a confusion between acronite and belladonna. So I asked the agent, like, to compare these two medicines and which should I use for the fever. So it is asking if exposure to cold wind or fright preceding fever, then acronite should be used. If it is red congested face with throbbing carditis, dilated pupils, then belladonna should be used. Is the fear, anxiety, restlessness more marked than heat than acronite, or delirium, throbbing pain, or rush of blood than belladonna? So it gives you a lot of freedom. It gives you a lot of like flexibility to basically like in your practice. So one more thing. So you must have encountered like a case where a patient comes to you, and you in your mind you must be thinking that in the past there was one more patient who was very similar to this patient. So with this differential diagnostic agent, like you can like attach cases here. Like for example, if you attach two cases, then you can compare between like these two cases. Like what is the differences and what are the similarities between these two cases, and how why do we think like you should do the same remedy or different remedy. So this is like the differential diagnosis part of the question.
So I think there's a small network glitch.
Yeah, I think
Now you're audible. Meanwhile, for small time, you're not audible.
okay. Now I'm audible.
Yes.
Yeah, cool. So yeah, so I was just saying we have a case taking feature also. So right now, we developed this software because you must be knowing in the homeopathy, the only software which is known till now, very popular till now, is Radar Opus, Zomeopath. These three four softwares are there, but those are very outdated. If you would have used them, it is very hard to use those software, and it is very hard to find the remedies or some or anything. Like if you want to study about some remedy, or you want to study about some symptoms, it is very hard to do that. But our software is very user friendly, because you can just literally type your thing out. You can give it what you are thinking, and it will give you like answer based upon that. It will search all the repertories, it will search all the materia medica, it will search all the literature, journals, and then give you answer based upon all of that. So yeah, so that is, and we also have a miasmatic agent. So some doctors are only like very focused on the miasma part of the patient. So psoriatic, syphilic, hyperpathetic, canceric. So basically, if you give it some symptoms, it will give you the analysis based on the miasma of that patient. What do we think? This case is. Uh, so so for example, here it is saying that the miasmatic rubric compendium, and it is giving like a pesora, sora for mental rubrics 2, physical rubric 3, pathology rubrics 2, family history 1. So it is saying that it is giving you the rubric and observe this, then link miasma, pesora, tubercular, psychosis, and based upon the end, it is telling you the underlying issue, the deep layer findings. That it is the mind category. Underlying issue is repetition of sensory gratification, fixation, and miasma origin for the same. So this is a very advanced, because miasma is very hard to get. There are multiple layers to find out the exact miasma of the patient. You have to see how the patient is talking, what are the family history, based upon the symptoms. In the front, they may be saying that they are having headache, but if you go long back into the history, it could be like they are because of they are thinking about something in their mind again and again, because of which they are having this problem. So yeah, this miasmatic agent is one of our advanced agent. Yeah, so this one last agent I will cover, which is the case copilot. So what happens when a patients come to you, doctor? So you ask that patient some questions, right? So basically, if I tell this agent hi, then it will ask me it will ask me a bunch of questions. The initial question is like, what is your chief complaint? Like, what is your main complaint right now, and since when? Describe the sensation, location, and what clearly makes it better or worse. Are you generally a lot more of a hot person or chilly person? How would you briefly describe your current mental or emotional state? So this is actually replicating exactly like how a doctor deals a patient. Whenever a patient comes, the doctor asks them a bunch of questions, and then the patient respond, then you ask them some more questions to refine your basically understanding of their case, their constitutional profile, what all things they might be having. If they are saying headache, that does not mean that it is only related to head. It might be related to something in their stomach also. Their mental or emotional state, what kind of dream they're happening. So all those things basically, yeah, this agent then this is like what should be the best like symptoms or disease for it.
So you're not audible.
Hello.
Yeah, Tejas, there is some network glitch from your side.
Okay. I'm audible now.
Yes, you're audible.
Yeah. So basically, as you can see, like this is a case copilot agent. Like you give it high, then it asks you a bunch of questions. What is the main complaint, and since when? Describe the sensation and location. What exactly makes it worse or better? Are you generally more of a hot person or chilly person? Then you tell it like what is the main complaint? You tell it headache. Then it asks you a bunch of more questions like headache, but since when? Hours, days, months, or sudden or gradual onset? What exactly is the pain and how does it feel? Forehead, temples, one side, back of the head, throbbing, pressing, bursting, stabbing, man-like. What clearly makes it better or worse? Motion, when you are in motion, is it better one, or when you are lying down or resting, is it better then? And in general, like whether you are a hot or chilly person. So you can give it like answers. I'm a hot person, it is throbbing like headache, and it gets better when I move. So you can give it the answers to his question. Then, based upon these answers, it will either decide to ask you some more questions, or it will directly like give you like the diagnosis and the like for example now it's saying that it got the complete profile from the answers, and it is summarizing all of that first. The main complaint is headache, sensation is throbbing or pulsating type, modalities is better from motion or moving around. General, you describe yourself as a hot person, tends to feel warm, less care covering. It tells you what the rubric mapping, pain, head pain, throbbing, pulsating, head pain, motion, emulation, general heat, aggravation, patient hot. Then it tells you like the final remedies, which is matching these symptoms perfectly: belladonna, byrona, pulsati, azelcinium, sanguinina. And at the end, it is also giving a clinical decision guide, like if it is one eye rate or frontal, any claim modalities of thrust and food desires, emotional state during headache. So in the end, it gives you most relevant remedy, that is a pulsatia. So for warm-blooded person who often dislikes stuffy rooms, better in cold, open air, gentle motion. It is better in open air, gentle motion, cool application. So it also give you like one to think of this medicine when the headache is throbbing in a hot person, that is clearly better walking and moving, especially in open air with possible fullness or aggravation in warm and cold closed room. Then you should use pulsatia. So yeah, as you can see, like this like this is a very like a sophisticated thing. Like this is a case taking feature. In the like left, you can see a case taking tab. If you click on it, like you can in the bottom right, you can see a create case taking. You click on plus here, then it will open this form. In this form, you can see there is a case taking form. And it is a complete like a case taking, how a classically like a doctors do a case taking of the patient. What is the patient name, age, gender, marital status, occupation, development milestone, what is the chief complaint characteristic, you can enter that here. What is the complete symptom profile from PQRS method, you can mention it here. What is the causation, onset, what are the modalities, the hunger, desire, craving, appetite, aversion, food aggravation, sleep pattern, dreams, fanning, covering, sensation, reaction, disease reaction, sight, quantity, character, effect. How is the like urine frequency, low quantity, sediments, complements. How is the stool frequency, character, complements. What are the mental generals, adverse and under causes, present mental state, mental reactions, perception, memory, thinking, concentration. What are the physical examination, any past medical history, family history, or asthmatic background, everything. So this is the complete symptom case profile of the patient, which is very hard to do like otherwise. But because you are using AI, like if you like enter like answer to some of the questions here, it will be able to give you like like if you fill it, for example, let's say my name Tejesh, my age is 29, then I'm a male, then I'm a single, then occupation, I'm a software developer, AI researcher. Then I can tell it my main complaint is headache, for example, then throbbing headache. Then, so for example, I do not want to fill the whole form. I can just give it like some details, and then I can click on here, save and give remedies. Then it will like take these all details in this form, and it will analyze the case. It will call our AI, our proprietary AI agents, which will basically think over all these details, all these symptoms, all the things, and it will give you like a profile of it, like a symptom summary card. It is headache, it is a throbbing type, character pulsating, no location specified, the modalities, etc. Then it will based upon all the information which is available till now, it will tell you if it is congestive, red face, or heat in the head, then it should be belladonna. If it is worse from motion, noise, or light, then it should be belladonna, nauseum. If it is less from mental strain or overwork or screen, then it should be nux vomica. Gelatin should be the best remedy. Then we can also evaluate the constitutional clue. Like if it is hot and plethoric, then belladonna, sedentary, irritable, coffee user, nux vomica. Dull, heavy, and head from exertion, that is delirium. So then it is like giving a like an internal repetition table. Then it is giving you other that rubrics. Then it is giving you a detailed remedy cards for the same. So as you can see, like this is literally like with the power of AI, it is able to like reason through a lot of things at once, which you would have otherwise not be able to do. The like AI can like leverage very large amounts of data, and then tell you like the appropriate medicines, appropriate diagnosis, what is the things you can do, everything. But without AI, like you are very constrained to only a particular area which you have studied or which you have knowledge of. But if you use AI, you could leverage the knowledge of the whole literature, all parts. Even if you are just a specialist of, let's say, hair or skin, you could still have a very deep knowledge of the heart, of the kidney, of the stone, which is very important to have to give an appropriate diagnosis and remedy for the patient. So this is like where our solution shines. It gives you a tool which is like a complete end-to-end solution for your homeopathic practice. Like you don't have to use any other software. If you are using a software, you can create up your patient profile. You can ask it like what is that particular disease this patient may have. You can ask it like what remedies do we think according to our like AI should be best for this patient, and you can ask it like exact rubrics or para rubrics, exact like reasoning behind like why do we think this should be the case. You should ask it with mother tension should we use, what is the potency should you use, and much more. Basically, if you only refer to some particular repertories, you can just use the agents which are like tuned for those repertories, like Kent, Murphy, or synthesis. If you are someone who you want to leverage Materia Medica, you can talk to Materia Medica agent. If you want to diagnose some particular case, for example, a patient come with a skin disease and that skin disease may be due to a lot of there are hundreds of skin diseases out there in the world. So you want to know what exactly is the skin disease according to AI. You can give us the image of that skin disease, and we can tell you the main diagnosis of that disease. Or you can just give our AI the main complaint, for example, chest pain, and it will ask you follow-up questions based upon that. And in the end, it will give you the provisional diagnosis along with what kind of diagnostic step you can take, whether the patient should do the MRI next, should do the CT scan next, should do the CPC, LFT, KFT next, or is the available information sufficient for us to answer your questions. So yeah, doctors, if any one of you have any questions, feel free to raise your hand and ask them. Thank you. And one more thing, I have sent the link of the site in the chat. So just sending it once more again. So for the people who have joined later, there is a free trial to use the app. Every one of you can go to this link and can sign up and can see the app for yourself, and can send us any suggestions if you would have. I'm also sending my WhatsApp number. So if you have any suggestions, feedback, or any questions where you feel that the app should be able to do this, or app should be able to do that, or you have any confusion why is it not happening this way or that way, we are more than happy to cater to all your requests. We strive to do be the best of homeopathic software out there, and your support, everyone's support will make it happen. We want to become the next generation of homeopathic software. We don't want doctors to use the old radar or Homeo, which are very outdated and hard to use. This is our in-house Indian solution, which is developed by our own IIT engineers, which we should be able to cater everything you need regarding your homeopathic practice. Thanks.
I have a doubt. Hello, can you hear me?
Yeah, I can hear you.
About the diagnostic and this investigations part. So, what do you depend for that? What are the resources you depend for that?
So it's a very good question, doctor. There are a lot of diagnosis literature out there in the market. There is a 5-minute diagnosis book. There is a differential diagnosis book written by multiple authors. We have trained our AI based upon all the latest medical diagnostic, all the latest diseases out there in the world. There are more than 10,000 plus diseases which a patient could be suffering from, and there are symptoms for each of that disease, very unique symptoms. So we have trained our AI to basically know about each and every of those disease, and what are their symptoms, what are their modalities, and what all supports do we need. For example, in the case of ECG, if the ECG is not regular, if it is down 2 times, then it could be left side of heart blockage. We have trained our AI to on hundreds or thousands of data like this. So this is what makes this is very special. This is how only so much one doctor can know. There are so many diseases that it is even hard to keep it on one single computer, let alone the doctor's brain. So the AI comes to your rescue here. You can give it your disease, skin disease picture. You can give it your blood reports. You can ask it. You can give it the symptoms, and it will ask you some clarifying questions. And based upon that, at the end, it will give you the best possible diagnosis for this particular symptom profile, image, ECG, blood reports, MRI reports, scans, etc. So this is where we shine. We have trained it over like thousands or lakhs of data points to make it the best possible thing in the market. Thank you, doctor.
Hello, can you hear me?
Yeah, I can hear you.
Yeah, I have a doubt that can we integrate this corporate into any dedicated softwares like a chat box or something?
Like
An AI assistant, like an AI assistant in a software.
yeah, we don't support that at the moment, like directly support, but we do offer like a support for some clinics who want to develop their in-house software, yeah, AI assistant. We do offer like services for that. So if you want the AI which is only trained on your clinic's data, your internal knowledge base, we offer solutions for those also. So for example, I will send one more link in the chat. So this is our another company, IITengineer.com. Here we offer solutions like, for example, if you want to develop your in-house AI software, we do consultants with this from this company, and our engineers will be able to make a customized chatbot for your own use case.
Yeah, we already have a software, but it's not AI powered. So I was thinking we can we cooperate, integrate that, yeah, your AI part with our software, like
Yeah, we can discuss about that. I think in offline or some in the other meeting. Uh, yeah, you can reach out to me on WhatsApp. We can discuss about that.
Okay.
Meanwhile, I will request everyone to just go to our software and please sign up and just try it out for yourself. That software offers so much that it is very hard to tell in one call like what all it offers, because like there are so many features. But I hope like everyone got a high level picture like how AI is changing everything, not just homeopathy. It is changing like a lot of like all human like it is like industrial revolution was the last revolution where like the world changed. This is like now the one more AI revolution you can call it, and it is slowly and slowly like changing the whole landscape. So the doctors which will leverage the AI will become 10x doctors. That is my belief, and we want uh, like every one of you to become like 10x doctor from what you are today, to say supercharge your clinic and homeopathic practice with the AI.
Hi, brother. Thank you once again. On this occasion, I am utilizing this occasion for a uh, words of thanks to Dr. Jumana, our webinar coordinator. Hi, Jumana. Thank you for serving as our webinar coordinator. Uh, your service was very nice. For that only, from the onwards, from this point, you have led it in the best way. Now, Dr. Jumana is going to her own clinic. So we are giving a very best yatra, what we say, best wishes to Dr. Jumana in her career, as well as please be in the and uh, her service. We are appreciating and thanking for her service for this student. Thank you. Then one more is there. I hope everyone is enjoyed, and this is you have to learn our policies, hospital policies. You have to learn not only this one, everything you have to learn. Our policy is to bring a platform and show you one of the platforms, as well as these are the leading ones. From my experience, I have studied many platforms and one among them with them, and you have to learn and you have to go ahead. Anyway, you should implement the AI into the homeopathy. That is the only thing we wish to. That is the motivation behind me. And you should decide what it is. That is rest of you, not nothing else, and I am not responsible for anything. I hope everything is positive. Okay.
Thank you, doctor. Thank you. Thanks a lot for the giving us the opportunity to showcase this AI software to the the whole community, and we wish that each one of you gets a chance to like learn more about the software, how the AI is shaping the world, how we are leveraging the AI to basically supercharge homeopathic practice. We believe this is the future, and this is and you all are the leaders, doctors, who have who are eager enough to like learn these new technologies to supercharge your clinic. I really appreciate each one of you to giving us your time yeah. Looking forward to your solutions, like your feedback, your usage on our platform. We are more than happy to cater to any of your question. If you have anything, if you are curious about AI, or if you think that we should incorporate something more into our platform, if you think this thing is, if you like this thing should also be used in the platform. So all of that, like, we are open to. And yeah, we offer free trial, so you can sign up without worrying about anything into our platform and can start using it. And we are 100% sure that you would be surprised how much it can do, because that is the feedback we have got from a lot of doctors who have used our platform till now. So I hope that will be the experience for you also. Thanks a lot for giving your time.
Thank you, Tedesh, sir. That was a very interesting and enlightening session. I hope you're also a beneficiary of homeopathy because you know so much about homeopathy.
Yeah, I'm working with this for the last 1 year, so that's why now I have a lot of knowledge about this and different techniques, different. So I have talked to hundreds of doctors. That's why this. So we needed someone who is expert in AI and who is someone who is an expert in homeopathy. So the person who is expert in both only can build a software like this. So it is a rare combination, and that's why we think we are the leaders in this, and we want all the doctors to basically embrace the software. Whether you think it will be useful or not, just use it with the open mind, and just try to feel how the AI is revolutionizing the whole homeopathic space.
Yes, sir. I think now in this AI era, we also have to be updated from
Yes.
software to this AI.
Yes, exactly.
Thank you so much. And now I invite Dr. Lasima to deliver the word.
Good afternoon, everyone. Today's discussion reminded us that when we combine modern technology with our medical expertise with AI, we have the opportunity to bring the vast knowledge of the entire world to the bedside of every patient. So first of all, I thank Dr. Basil Yousuf, MD, Dr. Basil's Homeo Hospital, for conducting such an informative webinar session for us, and also Mr. Tejesh, founder of Homeo.com, for introducing such an inspiring software to the field of homeopathy. Thank you once again, everyone, for all attending the webinar. Thank you.
Thank you. Thank you.
Thank you, everyone.